are you both
Hi,
doing
how
today?
are you?
Good.
Hi, I'm Suzanne. I'm the nursing associate on this floor. I'm going to be taking care of you and a few other patients tonight.
Okay,
So how are you feeling?
pretty good.
So are you diabetic? Do you take your blood sugars at home or?
No, I've just been diagnosed with diabetes, so
Okay.
I'm learning and Ashley's going to help me.
Ashley, are you hounding her again?
I just asked her name, Allison.
I understand, but you can't. You're gonna make her nervous.
Are you a nurse?
I'm in nursing school. I graduate in May, so I'm gonna make
congratulations.
sure that I watch everything that you're doing.
She's gonna try to make you nervous. Just don't
No,
pay attention
I'll
to
be
her.
watching just to make sure everything's going.
Oh, that's okay. So it's good to have nice people to care for you.
Yeah.
But right now I'm just going to take your blood sugar.
Okay.
You can't tell you're gonna watch her.
Zip it just for today, okay?
You
Let me
need to
just-
zip it.
Let me just do this.
Alright.
All right, first I'm going to scan your ID band.
Okay.
Good. And is there a finger you prefer or a hand or?
No, you could use any finger over here. That's fine.
Okay.
Stop. She's scanning an ID band. Why are you doing that?
Just. All right, you are going to feel a little prick with this, okay?
Okay.
Okay. Okay, your blood sugar is high. It is at 320, so I'm going to go
320?
tell the nurse. And then
Are you
we'll
telling her
probably
now?
give you some. Yes, I'm going to go tell her right now and see if you have any orders or anything for that. All right, was there anything else you needed?
No, that's all. Okay, thank
See you in a bit.
She's a 23 of Dr. Jerome. She's a full code. She is new onset diabetes. Her blood sugars have been all over the place lately. Last night it was 400. They covered that with 15 units of
Excuse
regular
me, are you talking
insulin.
about Miss G in room 2?
Yes.
I just got her blood sugar. It was 320.
Okay. Thank you. Thank
You're
you very
welcome.
much. Okay, so that's pretty high, and we'll probably have to cover that. We'll have to see what the doctor ordered. Last night she was also given Lantus, 50 units of Lantus.
Okay.
Since her blood sugars have been all over the place and she is a new onset, we're going to have to do a lot of teaching. We're going to teach about the carb-controlled diet, the different types of insulin. Her family is in there. She has 2 sisters that have really been there for her, but they're very overbearing. She has a sister who's a nursing student, and she thinks she knows everything.
Okay, great.
So, direct comments to them to include them on the teaching. Why don't you go on the computer and check and see the sliding scale and what we need to give for that? How many units?
Okay, it's room 2, Sarah G. I'm going to be completely honest with you. I think I slept through every single diabetes class during school.
Okay. Well,
So
when you do sliding scale insulin, it's usually the regular insulin.
Okay.
So,
Yeah.
we could talk a little bit about that before we give it.
Okay, that would be awesome.
The regular insulin is the Humalog, and it'll say right on the bottle, it'll have an R on it.
Okay.
And that's short acting. The onset's usually a half hour to an hour.
Okay.
The peak is 2 to 3 hours, and the duration is 4 to 6 hours.
Okay.
It's usually given 20 to 30 minutes before they eat. Then there's the rapid acting, which is the Humalog, and that onset's real quick. It's within 10 minutes. The peak is at an hour, and the duration is 2 to 4 hours. There's also intermediate, and that's when the bottle has an N on it, and that onset is 2 to 4 hours. The peak is 4 to 12, and the duration is 16 to 20.
Okay.
There's also the very long acting, that's the Lantus that we give sometimes at night. I don't remember. Dr. Jerome, do you happen to know the peak of Lantus?
Are you serious?
Yeah.
You should know this by now. How did they pass the NCLEX?
Well, you think you'd want to help me out here if I don't know.
Him and his peach shirt.
Well, don't worry about Dr. Jerome. He is like that. Let's just go draw up the insulin because our priority is the patient.
Okay.
Okay. Okay. So this is the regular insulin. And since she was 320, you'd give 10 units of this.
Yep.
Okay, so you know how to draw it up and everything, right?
Yeah. Oh, yeah.
Okay. Well, I'm going to go talk to the nurse manager. We're supposed to be getting another admission. So
Okay.
we're really busy. So just draw it up and meet me out there, okay?
Okay, sounds good. Okay, they think I'm a complete idiot and I don't know what I'm doing. It's ridiculous. Humal and R. Okay. 10. Okay, here we go. Oh, that looks like a lot. She said 10 milliliters. I don't know. Okay. 10 milliliters.
Well, I'm getting real hungry.
Well, why
Stop.
don't you go to the cafeteria?
Well, I am, but I need to make sure that you're going to write everything down.
I'm going to write everything down.
All right. Do you want something?
Yeah.
Okay. I'll just pick you anything.
Yeah, whatever you want.
Okay, everything needs to be written down.
Everything will be written down, I
All right.
promise.
All right, Allison. I'll be
Right.
back. I'll be back, Sarah.
Okay.
Hi, how are you?
Good.
I'm Megan. I'm the nurse that's going to be with you today. How are you feeling?
Good.
Any pain?
No, none.
No? Okay. Can I do a quick assessment on you?
Sure.
Are you able to sit up for me?
Yeah.
I'll listen to your lungs. Okay. Take a nice deep breath. And again. And again. Okay. All right. Well, your assessment is done. Your blood sugar was 320, which is high. So I do have insulin for you. I've got 10.
Okay.
So I'm going to go ahead and give that, I think. How are you doing today?
I'm good. How are you?
Good.
So you're giving her 10?
Yes.
Okay. I need to know everything because my sister's crazy and she's a nursing student. She's going to come in here and want to make sure that you did everything right.
Okay. Okay. Alrighty. Well, you are good to go. I'm going to go chart your assessment. And I'll be back later. Let me know if you need anything.
All right, thank you.
Okay.
Want to go ahead and order lunch now?
Yeah.
No, this hospital, I tell you, it's closed.
Well, maybe Sarah will share something with you.
I don't want to take her food. Did you write down everything that
Yeah, the nurse was here. She
Okay.
came in. She gave her insulin. She gave 10.
10
And
what? You
I
didn't
don't-
write it.
She didn't say anything.
She just said 10.
She just said 10.
Was it like a little orange syringe?
I don't remember.
I don't trust new nurses.
Well, you're gonna be a new nurse. No one's gonna trust
Yeah,
you
but
either.
I trust myself.
No, that doesn't count.
How are you feeling, Sarah?
I'm just so annoyed.
Do you think something's wrong?
I don't know. Why are you feeling like? Are you
I
hungry?
don't know. I don't know.
Order your lunch.
We're gonna order a lunch.
I don't feel good.
You're sweating.
I don't know. I just don't feel right.
Ashley, you're the nurse. What's wrong with
Well,
her?
I don't know. I wasn't in here when the nurse was in
I'm
here.
gonna throw up.
Put her in that basin. Oh my gosh. Nurse! Just call it on nurse. She's throwing up in here. Nurse.
Hey, how you doing? You're not feeling well?
No.
Oh my God, you do not look good.
What did you do to
Can
her?
you tell me your name? Can you please state your name for me? Sarah, do you know where you are? Do you know where you are?
I don't know. I don't know what she did. What did you do to her?
Oh my God, I'm calling the code. I need help. I need some help in here.
I think that's your patient over there.
I need some help in here, please.
Sarah.
Oh my God, can we get some vitals?
I gotta get in here. I'm right here, Sarah.
Can we need a blood pressure?
We gotta get you.
We gotta get a blood sugar.
Ashley, but that's my sister.
Ashley, we need to work on her.
Ashley, come on. Here we go. Blood pressure.
What's going on here?
A 23-year-old female came in for diabetes. She's diaphoretic. She was throwing up. I don't know.
Did you give her medication?
Yeah, her blood sugar was 320. I gave her insulin. I gave her
How much?
10 milliliters of IV insulin.
Wait, come again. 10,
Regular insulin, yes.
10 milliliters?
10 milliliters IV.
Not units.
Are you okay?
What the f is wrong with you?
Oh my God. Oh my God. I
What's
wasn't
the rate of rhythm?
I wasn't
Science
even
grade
thinking.
30.
Blood sugar?
30. Oh my God.
I need 1 amp of D50 IV stat.
I'll get it.
Oh my god. Oh my god. I don't even know
What's? Are you stupid or something?
I don't know.
If you're gonna cry, just leave. I don't need you right now.
Oh my god.
Come on in. Have a seat. So I heard about the code that happened downstairs, and I want to hear from you what you know. Do you want to tell me what happened?
I gave the patient 10 milliliters of regular insulin through her IV instead of 10 units sub-Q.
Okay. Now you're her preceptor. Did you witness her drawing that up? Or?
I didn't. I was busy and I just ran out of the room when she was drawing it up.
You know, that's a big error.
Right.
And it's probably going to turn into a big deal. You know, the daughter was a nursing student, and she was very upset about how things transpired.
Right.
And she's putting a lot of blame on the nursing staff for not doing the right thing. Beforehand, did she ever ask you about, you know, what should I do?
She did mention that she was uncomfortable with the different types of insulin, and I went over kind of the onset peak duration with her of the different types of.
So you drew up 10 ml of regular insulin instead of 10 units, and you gave IV instead of sub-Q. Okay. And the patient, obviously, what happened. I was there, so I did get to see kind of what happened. And we'll talk more about what happened during the code. But how do you feel about it?
I felt horrible.
Okay.
Like idiot.
Well, I'm going to investigate this further and find out what the correct disciplinary action is, and I will have to give that to you. I know you're new and you made a mistake, and I'm really sorry that it happened. And I know that you are too. Luckily, the patient's okay, so that's a good thing, right? But we still have to deal with the error. Now I'm going to talk to Dr. Jerome, too, about what he did.
Okay.
Okay? Now tell me what happened with Dr. Jerome.
While we were in the room during the code, he was like swearing at me and just completely like yelling at me, and he even threw a cup at me.
I saw him throw the cup, but I didn't hear everything he said. What were some of the things he said to you?
I mean, like he was saying swear words and just saying I was an idiot. And just, you know, I made a big mistake.
Did you file an incident report?
Yeah, I did.
Okay,
I
good.
I wrote it on the computer.
We did the right thing, and I don't think that was very appropriate, him doing that in the room, especially during that time. What happened, it happened at that point, and he needs to be understanding and try to fix the problem rather than get angry and upset and do this type of thing. So I will have a talk with him as well.
Okay.
And I want you to know that you did make an error, but you learned a very valuable lesson. And going forward, you're going to know now exactly what to do. And as a preceptor, you need to be very careful with the new grads and how they drop insulin, anything they do, until you're completely confident that they know exactly what they need to do when they need to do it. What you could have done was just watched her do it, went into her for the first time, and then after that, trust that she'll do the right thing.
Okay.
All right? So I'll deal with that. Okay, in the meantime, you guys can go ahead back to work, and I'll let you know what happens from here on out. Okay?
Okay, thank you.
All right. Thanks. Come on in. Dr. Jerome, if you want to have a seat, bud. I gotta talk to you. Now wait a minute. Before you even say anything, I was in that code, and I heard some of the things that you said and some of the things you did. There was an incident report filed by the nurse that took care of the patient.
The incompetent nurse. I'm tired of these incompetent nurses you have here.
Okay.
She gave 10 milliliters of insulin,
I know she did.
not 10 units.
Mhm.
And the patient almost died.
I know.
I can't be...
The nurse that took care of the patient filed an incident report about your behavior. Said you swore at her during the code. I saw you throw the cup at her.
They're incompetent, they're dumb, and they need more training.
Now, wait a minute. Okay, you're already starting off with insults, and this is why I'm talking. This is why you're in here. How appropriate do you think that is?
How appropriate was she to give 10 milliliters of insulin?
It wasn't right. She made a mistake. But for you to go off on her like that and throw something at her is extremely inappropriate, and I will not have it.
I'm just tired of it. I'm tired. I can't do this every day.
Well, maybe you need to think about what you can do to help the situation rather than getting angry and doing things like that. Because when you do those things, you're going to find yourself in the same situation. Right here in my office, having to face the fire. I want you out of here. You got it? You're inappropriate, you're mean, you threw something in the code, and it's still going to be dealt with. I'm going to call for a suspension and get you out of here for a few days if you can reflect on what you think's appropriate.
You do that.
Yeah, I will do that.
All right.
All right.
Where are we parked?
First floor.
Thank God today's over.
I know, it was so stressful. This was one of the most stressful days I've ever had.
Dr. Jerome doesn't
Oh
need
my
anything
God.
better.
No, he's so ridiculous. I'm glad he got yelled at.
Yeah,
he deserves it.
He needs it.
It's
That was-
unbelievable.
Yeah.
There's no reason to treat anyone like that.
Going down. Going down.
I got it. Thanks.
Nurses.
First floor.
Nurses that don't know what they're doing.
Going up.
Cut. And action.
Yeah. Let's get like baby powder.
That's me.
You new grads like to do this?
What are your lines?
Cut.
And it'll last the duration of 2 to 4 hours. And when are you gonna turn up and sing? What did you do? Can you say your name for me? Can you tell me your name? I need to call code. RT! I need help in here. I need some help in here now. Can we get a blood sugar? Okay.
We're happy because our patient just.
I know, I'm sorry. Wait,
No, it's
one more
alright.
time.
Thinking about that door.
But it's heavy. said there's 30.
30. You better give it a good 30.
Let me go get me.